What if I told you your body has a silent alarm system, one that most of us completely ignore? We often dismiss it as a simple annoyance, a passing allergy, or just another part of getting older. But what if that persistent itch in a specific area of your skin wasn't a skin problem at all, but a messenger trying to warn you of something much deeper? We spend our lives learning to interpret external signals, but we rarely stop to listen to the ones coming from within. Experts like Dr. Laura Rodriguez, a renowned oncologist with decades of experience, warn that certain types of persistent itching can be the very first whisper of a serious illness, months or even years before other symptoms appear. How is it possible that something as common as an itch could be connected to such serious conditions? And more importantly, how can we learn to differentiate a simple irritation from a warning sign that could save our lives? Today, we're going to uncover that mystery. Join me on a journey through 6 key areas of the body where an itch could be more than just an annoyance. What you're about to discover could forever change the way you listen to your body. First warning zone. The calf. Picture this scene. It's 3 in the morning. You're sound asleep, but an intense itching sensation on your lower legs wakes you up. There's no rash, no redness, just an itch that seems to come from deep within. Your first thought is dry skin, or maybe poor circulation. You apply moisturizing creams, but the relief never comes. According to Dr. Rodriguez, this pattern is one of the most underestimated warning signs. When the itch is concentrated on the calves, worsens dramatically at night, and doesn't respond to topical treatments, it could be pointing to an imbalance in the lymphatic system. Lymphoma, a type of cancer that affects the system, causes the release of inflammatory substances that irritate the nerve endings in the skin. The skin itself is healthy, but the immune system is screaming for help. The crucial detail here is the nocturnal pattern. During the day, activity and circulation help disperse these substances, but at night, when you're at rest, they concentrate, making the itch unbearable. The home test experts recommend: if after a week of applying creams the itch is still there, especially at night, the source probably isn't your skin. Second warning zone. The middle of the back. Do you feel a persistent itch in a fixed spot on your back, right in the center? It's easy to blame your mattress, bad posture, or the fabric of your shirt. But what if I told you that exact spot could be a direct reflection of what is happening with one of your deepest organs? There is a direct nervous connection between the pancreas and the middle of the back. Dr. Laura Rodriguez explains that when the pancreas is in distress, either from inflammation or a developing tumor, it can send signals of referred pain or a referred itch to that area. The most baffling part is that the skin looks perfectly normal. But here's the clue that changes everything. When does the itch get worse? If you notice it intensifies right after eating, especially meals high in fat, the alarm should go off. That's the moment when the pancreas has to work hardest. Clinical cases have revealed that patients with early-stage pancreatic cancer reported this symptom long before experiencing obvious digestive issues. It's not just an itch. It's an itch with a schedule, and that schedule could be giving you vital information. Third warning zone. The scalp. An itchy scalp is almost always associated with dandruff, dryness, or a reaction to shampoo. But we're about to explore a very different kind of itch. This isn't a generalized itchiness, but a persistent, localized sensation behind the ears or at the nape of the neck, where the hairline begins. And most importantly, there are no flakes, no scabs, nothing visible. Experts like Dr. Rodriguez point out that this could be an early sign of leukemia. This blood cancer causes an overproduction of abnormal white blood cells. These cells release cytokines, inflammatory substances that can accumulate and stimulate the sensitive nerves of the scalp. The pattern is similar to what we saw with the legs. It gets worse at night. Furthermore, it is often accompanied by other subtle symptoms we tend to overlook. Fatigue that doesn't go away with rest, small bruises that appear for no reason, or cuts that take longer than usual to heal. If you've changed all your hair products and that specific itch won't go away, it might be time to stop looking at your skin and start thinking about what is happening in your blood. Fourth warning zone. The chest. When we think of breast cancer, almost everyone looks for a lump. However, there is a less common but very aggressive form called inflammatory breast cancer, and its first sign may not be a lump, but a persistent itch on one of the breasts. This itch is often mistaken for an allergy to a bra, an insect bite, or simple irritation, but the key lies in the changes that accompany it. The skin in the area may become red, feel warmer to the touch, thicken, or take on a texture similar to an orange peel. The crucial factor here is asymmetry. The irritation appears on only one side. Dr. Rodriguez emphasizes this point. If you notice itching, redness, and changes in skin texture on just one breast, and these symptoms don't disappear in a couple of weeks, it's essential to seek medical advice. And this isn't just for women. Although rare, men can also develop breast cancer, and itching around the nipple is one of the warning signs they most frequently ignore. Fifth warning zone. The intimate area. Let's talk about a topic few dare to discuss, but which is vitally important. A persistent itch in the anal or genital area is a symptom often attributed to hemorrhoids, a yeast infection, or poor hygiene, leading to embarrassment and a delay in seeking medical help. However, when the itch is constant, feels like a sharp pinprick in a very localized spot, and doesn't improve with the usual treatments, it could be a warning sign of cancer in the anogenital region. Specialists warn that the distinguishing feature is persistence. While hemorrhoids or infections cause intermittent discomfort, an itch stemming from a cancerous process is relentless and usually worsens at night. Also, look for secondary signs: unexplained minor bleeding, changes in bowel or urinary habits, or unusual discharge. Ignoring these symptoms out of embarrassment can cost you precious time. Early detection in this area is key and can make a radical difference in the prognosis. Sixth warning zone. Hands and feet. Our hands and feet are in constant contact with the world, so an itch on the palms or soles is often attributed to dry skin, an allergy to a cleaning product, or even a fungal infection. But what happens when the itch appears without a rash, without visible dryness, and is concentrated exclusively in these two areas? Dr. Laura Rodriguez explains that some internal cancers, such as those of the liver or gallbladder, can cause a buildup of bile salts in the blood. These salts can deposit in the capillaries of the hands and feet, irritating nerve endings and causing an intense itch, known as cholestatic pruritus. A very subtle visual clue that can accompany this symptom is a slight yellowish tint to the skin of the palms, palmar icterus. If you have tried every cream and the itch on your palms or soles not only persists but also wakes you up at night, it could be your liver asking for help. It's a distant yet direct signal that something in your internal system isn't working as it should. So, how do you know when to worry? We've looked at 6 risk zones, but the doubt remains. How do you distinguish a passing annoyance from a real warning? Experts suggest applying a logic of observation based on 5 simple steps. The 3-week rule. Common irritations improve in a few days. If your itch persists for more than 3 weeks despite basic care, it deserves attention. The cream test. Consistently apply a moisturizing or anti-itch lotion for 1 week. If the problem is skin deep, you'll notice relief. If the itch remains the same or worsens, its origin is likely internal. Check for accompanying symptoms. A concerning itch rarely comes alone. Have you lost weight without trying? Do you feel extreme exhaustion? Are you experiencing recurrent fevers or night sweats? These are its accomplices. Analyze the pattern. Is it a nocturnal itch? Is it always in the exact same spot? Systemic itches are methodical and repetitive, unlike allergies, which tend to be more erratic. Review your history. If you have a family history of cancer, your level of alertness should be higher. Genetics isn't a sentence, but it is a risk factor that requires you to listen more carefully. This information is not meant to create fear, but empowerment. It's about giving you the tools to become a detective for your own well-being. Knowledge is the first step toward early detection. Just as the largest tree begins as a tiny seed, many serious diseases start with signs that seem insignificant. Don't ignore these signals. Share this information with your loved ones. You could be giving them the key they need to act in time. Listen to your body. It's always talking to you.